The following program contains graphic images that may be disturbing. Parents are advised that these images may not be suitable for young children.
Getting a pelvic exam can be uncomfortable, right? But what if I told you you may not always need it? A new study suggests millions of women may have been receiving unnecessary pelvic exams and PAPS tests. OB-GYN Dr. Tristan Emily Bickman joins us now to explain. Can you tell us what the study showed?
Yeah, it's a pretty amazing study. It was just came out this month in the Journal of American Medical Association, and it was done over 6 years from 2011 to 2017, and it looked at young women, which they categorized as adolescents and women between the ages of 15 and 20. And it looked at, reported from the United States, and it showed that there were over 2.6 million pelvic exams done in this age group, and over 2.2 million pap smears done. And let me just clarify something. Pelvic exam and pap smears are two different things. Some people may not know, they kind of think they're one and the same, but they're actually two different things. A pelvic exam is when we manually feel the pathology or the anatomy in the pelvis, and a pap smear is specifically to get a sample of the cervix to screen for precancer cells on the cervix or for HPV. So in this study, they surveyed these women in this age group over 6 years and found that huge amounts of exams were being done. In the study, it also showed that of the 2.6 million exams being done on pelvises, almost 50% were unnecessary, which is a huge number. And of the pap smears, 3/4 were unnecessary.
Dr. Bickman, is it considered unnecessary because the guidelines have changed? Because I remember when I was in that age group, anyone who was prescribed birth control almost automatically had a pelvic and a pap smear.
So number one, they categorized necessary as somebody who had had an STI, like a sexually transmitted infection like herpes or gonorrhea or chlamydia, someone who had a pregnancy, someone who had an IUD, which is a device that goes in the uterus, or someone who had a symptom or a history that would warrant an exam. So anyone outside of that category, they deemed medically unnecessary. So that's one thing to consider. The second thing is guidelines have changed, number one. Guidelines have changed a while ago, but they have changed. But a lot of people practice kind of based on the old guidelines. Right now, the guidelines are that if you're less than 21, you don't need an exam. There is no data, there is no evidence to support routine exams in these women's because cancer, gynecological cancer, is so rare in these age groups that there's no proven evidence to do a study. Sadly, this brings up a big point, which is, like you said, you thought if you have to get birth control, you have to have an exam. Well, that's not true. And the sad part is women in this age group that are 15 to 20 need birth control. And because people think, well, in order to get birth control, I have to get an exam, they're not going to go in. And these are the people that are going to then end up with unwanted pregnancies or STIs they couldn't get treated because they thought they had to get an exam to get treated. Even for STIs, you don't need an exam. You can use a urine sample. They can have patients do their own swab, so no exams are needed. But these poor women think that in order to get help, they need an exam, and that's prohibiting them or preventing them from coming in getting help.
How should we approach this now, in terms of if you're a young woman, what should your expectations be in terms of your relationship with your OB-GYN in terms of testing, exams, et cetera?
I think what you need to have a conversation with your doctor, if you're going in for birth control or you're going in for an STI or for treatment for an infection you think you have or an exposure you might have had, you need to educate them too and let them know that you don't need an exam to get this help. Of course, if there's a medical reason such as abnormal bleeding or pain or something vaginally that's going on and they think that the best way they can treat you is to do an exam, then if you have a good relationship, then you should trust your doctor. But not always do you need an exam or a pap smear to get help.
Thanks for updating us on these guidelines and the study, Dr. Bickman.